Hello everybody, hello everyone, and welcome back again to my channel. For today's video, we're going to talk about the cardiovascular system, a brief review of anatomy and physiology. Let's start. On cardiovascular, the heart is the most important and vital organs here. The heart itself is a major pumping organ of our body that pumps blood and supply oxygenated blood into different parts of our body. It also removes carbon dioxide and waste products of metabolism, and also it maintains the blood pressure and as well as your heart rate. So through your vagal and your sympathetic and the parasympathetic and the medulla oblongata. So these are some of the heart functions that you had to remember. Now the heart and its layer. Remember that heart is a hollow muscular organ. So hollow and a muscular, so it will pump blood to squeeze the blood, and it will be able to give and nourish blood to different parts of our body. It has three layers, which include the inner lining, which is your endocardium, and then your muscular part is your myocardium, and then your outside layer, which is your epicardium. So this portion, and this is your myocardium, and this is your endocardium. So those are the three layers. It might be affected somehow with some inflammatory disorder like your endocarditis, myocarditis. Okay, so next is the pericardial space. So this is a space between your pericardium and the heart muscle here. So there's a space, that's your pericardial cavity, and on that cavity there is what we call the fluid, the pericardial fluid that nourishes and cushions the heart. This also can be affected with your pericarditis. So that's why we had to know this a little bit more. So pericardial fluid is 5 to 20 ml of fluid that nourishes, protects the heart as well, and so it will be like cushion and will move slightly like gliding function of your heart. So that's your pericardial space and the pericardial fluid. Next, now it has the major blood supply is your coronary artery. The circulation is a main supply from blood to the heart, so the arteries. Okay, now the coronary artery divided into two, your right coronary artery and then your left coronary artery. Now the right coronary artery supplies your right atrium, the right ventricle, the left ventricle and posterior septal wall of the sinoatrial node and your AV node. So your right atrium, your right ventricle, the part of the left ventricle here, okay, so that's your right coronary artery. Now your left coronary artery divides into two, which is your left anterior descending artery and then your circumflex artery. Now the left anterior descending artery supplies part of the left ventricle, this portion, and then the anterior septum and apex of the left ventricle. Now the circumflex primarily supplies the left atrium on this portion and part of the left ventricle. So that's your major blood supply of the heart. Conduction system. Okay, now the conductivity, electrical conductivity of the heart. It starts from your SA node or the pacemaker, what artificially is to start the conductive system of the heart. So SA node, then to your AV node, here, will spread here. Okay, then AV node, then to your bundle of his, then to your Purkinje fibers, like that. So like that function. So it will, the moment that it will spread the impulses, the same as your blood supply, the blood will go. So it happens in milliseconds. So that's how it is, from SA node, then to your AV node, then to your bundle of his, and then to your left bundle branches to right and left ventricle be your Purkinje fibers. That's your conductive system of the heart. Now, talking about the electrical activity of the heart, this would what we try to remember a little bit. So this is your PQRST U wave. So the P wave, the PR, the P wave represents as your atrial depolarization. So my code is PAD, atrial depolarization. So then we have the QRS, which represents your ventricular repolarization. So remember, the R represents your repolarization, but with ventricles. Okay, then we also had the ST. The ST segment is the interval between your ventricular depolarization and ventricular repolarization. So that's the interval between your ventricular depolarization and ventricular repolarization. That's your ST segment. And then finally is the U, which sometimes what I call to that is not being seen, but it represents your actual VR, or your ventricular repolarization. So that's the electrical activity. Remember the normal pattern all the time. So they also ask some questions about this normal pattern. So if there are like activities like a certain changes with their weights, so you might see that they are different. Like there are abnormalities on that. So remember this pattern, it is important. Okay? So that's all about electrical activity. We're going to tackle that in future videos on how to read the ECG of common questions that being given on NCLEX. Okay, then next is the control or the cardiovascular function of our heart. Primarily, of course, by autonomic nervous system, which is your sympathetic and your parasympathetic nervous system. Now, the sympathetic nervous system will release this norepinephrine and epinephrine to your adrenal adrenal cortex, and then your adrenal medulla. Adrenal medulla, such as your catecholamine. So these are norepinephrine. Remember, this is adrenal medulla, because cortex is your cortisol. Okay, and then the PNS is the release of the relaxing hormone, which is the acetylcholine. So that's why mostly for the heart, sympathetic nervous system increase heart rate. Okay, while with your parasympathetic is decreased heart rate. Okay, because acetylcholine is for relaxation. Now another is the direct function from the brain through your medulla oblongata. That's why it's also called as your cardiovascular center, which is the medulla oblongata. So that's the control of the cardiovascular function of your heart. Now, chambers of the heart and the valves. Now, chambers are the wall wherein the blood the blood was received by the heart. So it has 4 chambers, and that is your right atrium is here, and that is your right ventricle, which was here. Then have your left atrium, which was here, and then your left ventricle, which is here. So that's the 4 chambers. Each chambers has called the valves that function to prevent backflow of the blood. So that's the function of your valve. So if there are defects with your valve, then therefore there are mixing of your oxygenated and deoxygenated blood. So that's why it's very important that the valves are functioning well. Okay, remember that, okay? Because we're going to talk about later with the heart circulation. Now, talking about the valves, they have valves that we need to know on the heart. Now, the AV valves, the atrioventricular valves, is called the right tricuspid valve. Okay, now so it has 3 cusps. So we're in from between the right atrium and the right ventricle. So it will open up like that. Okay, when the blood comes in. Okay, and then it will close. So the blood from right ventricle will not backflow to the right atrium. Okay, so that is your right tricuspid. Now the left is on the left side, which is the 2 cusps, which is the mitral valve. Okay, the mitral valve. So it's located between, here's the mitral valve. We also have the valve on the aorta and prior to pulmonary system. Okay, pulmonary or to the lungs, your aortic valve and then your pulmonic valve. So remember that. Okay, aortic and the pulmonic valve, when they are together, called the semilunar valve. When we combine together the tricuspid and then your mitral, that is called the atrioventricular valves. Okay, remember that when you ask what are the semilunar valve, your aortic and pulmonic. What are your AV valve? Your tricuspid and then your mitral valve. Okay, very good. Next, let's go to heart circulation. So I have a question. Does the heart feel emotion? That's why you're in my heart. If you're going to answer it with the anatomy and physiology, they don't have emotions because the brain feels the emotions. Remember, your frontal lobe, it controls your emotions. So when you're happy, when you're sad, but it will affect your heart. When you're happy, it will increase the heart rate. When you're sad, it will slow down your heart. Okay? So heart circulation flow or the blood flow. So here is how it is. Okay. Now all blood from the different parts of the body, from lower extremity, will go to your inferior vena cava. All bloods from the upper part of the body will drain into your superior vena cava to go to your right atrium. So the blood is, remember, this is the oxygenated blood because they are used by the body. Now the right atrium, it goes to your right ventricle via what valve? Your tricuspid valve. Okay, so it will shut down, so it will not backflow. So from the right ventricle, it will go to your lungs to be oxygenated. And what valve? It is your pulmonic valve. So it will close again, so the blood will go to your pulmonary artery to the left lung, and then will go to your pulmonary artery to your right lung, and they are happy be charged with oxygen. Now after they are oxygenated and they are happy, they will go to your left atrium via your pulmonary veins from the lungs. So from pulmonary veins, then you will go to your left atrium. So it means that on the left atrium, it is purely oxygenated blood. So then before it goes to your left ventricle, what valve? Is your mitral valve. Okay, then they will close the mitral valve, then to your left ventricle. Now, since we need the oxygenated blood from the lungs to the left atrium, it will go to your aorta, and there's a valve there called your left, don't call your aortic valve. So the blood flow will go to your aorta. That's why it's big and pure oxygenated. Then it goes again to your body and then to your lower extremity and trunk, internal organs to be used up by your body. So that's your heart circulation. Remember, with the valvular disease, if there are dysfunction of your valve, the oxygenated and deoxygenated blood will mix, so that is not good to your body. So that is your you have to know that on the heart problem. So that is your heart circulation flow. Hope you learn from that. Next is your auscultation of the valves of the heart. I think I need to move my, where can I put? Okay, here at the center. That's me. Okay, now auscultation of the heart. Okay, now this also, some of the questions are, they appear on NCLEX, so we would like you to know about that. So first is your aortic valve. Now the aortic valve can be auscultated from the right second intercostal space. Okay, remember that, right? So here, from your clavicle 1 and 2, so that is your second intercostal space. So 1, 2, so that's your intercostal space where you can get your aortic valve auscultation. So from your clavicle, okay, so I cannot feel my clavicle. So below 1 and 2, so that's where you put your to auscultate it. Okay, then next is just opposite to that, because it's the right, then to the left is your pulmonic valve, left second intercostal space. Okay, remember that. So on the right side is your aortic, and then on the left side is your pulmonic. Okay, then next is your, I'm gonna put myself here, your tricuspid valve. Now to auscultate for the tricuspid valve, since it is more inferior a little bit, so that's the left four intercostal space. So it is located mostly on the left side of the body, on the fourth intercostal space. 2, 3, 1, 2, 3, 4. So that's it. The fourth intercostal space on the left side is your tricuspid, and your mitral is in most inferior, which is located on the fifth ICS space. Okay, here on the fifth ICS. So that is for your heart auscultation of your valve. Okay, remember that. That is the brief review of your cardiovascular system. I hope you learned from this video, and thank you so much for watching. Have a good day, and God bless you.